Hi there, it's Marsh from the Health and Wellbeing channel, and hope everybody's having a good day. Today I would like to talk to you about dementia, one particular type of dementia, which is vascular dementia. And indeed, I spent 4.5 years with a person who was struggling from this condition, and it can be a very, very wicked one indeed. And it's when people begin to have problems with reasoning, planning, the judgment goes, the memory, and the thought process in general, and usually identifiable, by the individual themselves, but also the close ones, the loved ones, family, friends. And what you can do, you can ask the doctor to carry out a couple of simple tests, and it will be based on, it might be simple arithmetic, simple sums, or it might rattle off, several numbers and say, 1, 3, 6, 8. And he might say, can you remember what the second number was that I said? And they'll yay or nay. And they might say, do you know what the lowest number was I mentioned? What was the highest number? He may ask a simple sum. If I went out and spent £1 and spent another £3, how much would that be? That type of thing, to see about all the calculators going on, remembering the sequence of numbers, and it's usually over and done with within 7 or 8 minutes. And it would be normal that the doctor would have a private chat with the loved one beforehand, just to ensure that, identify how they are with numbers. Might ask for some of the grandchildren's names, and maybe rattle some of them off and see if they can remember all the names, just to identify and see if you wish that they, can remember or not. If there is concerns, they can send you off for a scan, and on the scan it will show, if you wish, darkened areas of the brain where it's beginning to, in effect, close down, because that's eventually what does happen. The blood needs to flow efficiently through the brain, and it needs to get the oxygen there and the nutrients. And if it gets impaired, that's when we get the issues. It can be caused, the vascular dementia can be caused by many other issues, and it's not always, say, having a stroke. If it is that you have a stroke, sometimes it can cause it. If it is that you have a stroke, sometimes you don't even know about it for sometimes, and it comes at a later time. Sometimes you can run hand in hand where you got vascular dementia and Alzheimer's run along at the side. And as I say, if it is that you do have a stroke, it doesn't necessarily mean you are going to have vascular dementia. Indeed, there's a number of issues that can cause the dementia. And again, it's all to do with conditions what can affect the blood vessels and the flow of the blood. Again, signs and symptoms, you will notice someone getting confused, trouble paying attention and concentrating. You'll notice themselves, which is you know them well, and again, if you're a loved one, family or friends, and many times that's put down just to getting older, isn't it? Yeah. I suppose there is an element of that, but that along with being reduced not to be able to organise your thoughts correctly, not to produce your sentences as concise as you used to be, not being able to analyse a situation. Why won't the fire come on? Or if somebody's got a long fire and they're lighting it with a match and they're forgetting to use a match. And that's what does happen, very simply. Sometimes people, they're wandering around and forget what it is that they were going to do. It's just the nature of the beast. It's the problems of the memory. And folks do tend to get restless and quite agitated. And sometimes people begin to lose their balance. There's another one. Again, sometimes confused with just getting old, and sometimes it's the increase of a condition. People also struggle with controlling the bladder, and it can just pass urine any time. And on top of all that, unfortunately, a number of people do get depressed, and there's apathy expressed, and some people do get short-tempered. I said earlier that when somebody does have, say, a stroke, it doesn't always show at once, and sometimes people can have mini strokes, and they relate to that as a post-stroke dementia. And indeed, sometimes people can have mini strokes and not even know, and that's affecting the dementia. Sometimes the dementia can be either very, very develop over a long period of time, and sometimes very short. An example, there was a house where I used to go away for a month at a time and come home every week. Come home at the end of every month for a week. And a lovely couple, been married over 50 years. And this lady lost a husband. Been married, like I say, over 50 years. And the family asked me to stay on because Mum was already struggling with dementia. But nothing to an extreme. She did have a moment. Ever so sweet, beautiful woman. And she lost her husband. And we had the funeral and that. And then about a week later, I never forget, sat on the couch next to this lady. And other than, various conditions of the dementia being shown, she was bobbing around. She used to love helping me out in the kitchen. And this lady had said she lost her husband, and one of her daughters, who's probably the same age as me, come paying a visit. And her mum said, I'm just going to shut my eyes for 2 or 3 minutes. I'll never forget. And she used to power nap. And she would always sleep for literally 2 or 3 minutes or 5 minutes. And I often wonder how she managed that. And she'd wake up refreshed. And I'm trying to not say the lady's name, but she was with me. And half an hour went, and we thought, she's asleep for a long time. She looked okay, sat next to me. No visible sign of distress. And I think it was about an hour and 10 minutes later, and her daughter said to me, I think we should wake her. And I said, right, okay, fine. So I tried talking to her and get her to wake up, and I couldn't do. And it is hard not saying the lady's name, but she decided to wake her mum up. And she touched her on the shoulder and that. And she woke up, looked terribly confused, glazed, and she stood up and she couldn't walk. I had to go and get a people walker to help her to walk, and we were both puzzled, and not as much as her. The lady couldn't speak at that time. And anyway, she went to hospital, and it would appear that, the doctors put it down to an event. They weren't sure. Sometimes when they're unsure of something, they relate to it as an event. And it could have been the escalation or a stroke, or the escalation of the vascular dementia. So kept her in hospitals for testing for a few days, and again give her another scan. And you can see where another part of the brain had closed down. So the lady came home, and to be frank, she was near enough bedridden from that day. She could understand, she couldn't speak, but she could nod in acknowledgement. Sometimes she would shut her eyes, and this is what you find. You find that then there's other forms of communication come into the caring of it, of the individual. But from shutting her eyes and showing no physical or visible sign, she had deteriorated there. And again, this can go on for months, or indeed this lady's, I bet it was over the scale of around 5.5 years. And if you wish, the brain just slowed down bit by bit. And it is a terrible thing because, as I say, people then they can lose control of chatting. They can also lose control of acknowledgement, whereas if you wish, just looking forward all the time, just about close their eyes if they want to sleep. And it's a terrible, terrible thing. And the brain, it can get that bad where sometimes one can get out to swallow, lose control of swallowing and drinking water, and the same with eating food. Yeah, people forget to swallow food or can't chew, and that, I won't go into details, that brings into loads of other issues. So we've looked at what it is, and it is a bad one, and we've looked at some of the symptoms and some of the signs, and I'm going to leave that I'll leave it at that, I should say, in this video, and I'm going to create a second one very shortly, and that one will be looking at some of the causes. Yeah, I say it's not always just a case of having a stroke or something happening. What are the other causes what can cause the issue of the blood flowing effectively and getting the oxygen and the nutrients to the brain? Yeah, and some of the preventive measures in how to stop that. So for now, I will say a good afternoon from lockdown Berlin. Thank you for listening, and I do mean that. I hope to see you in the next video, and if you like this one, please subscribe, and see you shortly.